Hi there, thank you for joining us. My name's Noel with Advanced Dermatology. I'm here with Dr. Charlie Lucky Dunn.
Ooh,
thank you for joining us today.
Thank you for having me.
Doctor, tell us a little bit about yourself.
Thanks for having me. My name is Dr. Charles Lucky Dunn. I was born in Arkansas. I went to undergraduate at Clemson. I'm a Clemson Tiger. Mm-hmm. I actually joined medicine whenever I was in college after volunteering at a children's hospital with kids with cancer. And during this time, met the girl of my dreams, asked her father for his blessing for her hand in marriage, and he looked me square in the eyes. He said no. And so to prove a point to him that I was serious, I joined the Air Force. Then went to medical school. Went to medical school at Wake Forest. After medical school, the Air Force said they needed pediatricians, so I became a pediatrician, and I was stationed out in Anchorage, Alaska, for 4 years as a pediatrician, treating polar bear bites and moose stompings. That's not true. Wow. I'm just kidding. But I discovered a passion for dermatology there. Okay. I discovered a really big interest for the field, and part of that interest was steeped in, number one, that there is a lot of conditions in dermatology that are that kind of present themselves on the skin. You can tell a story, or you can read a story and interpret a story from someone's skin. And then also I discovered that one of the premier things that dermatologists do is they fight cancer. And I hate cancer. Right. And I have a huge passion to treat skin cancer, which is why I got into the field.
Okay, well that's actually how you and I met, because I work at Advanced Dermatology in St. Pete.
That's right.
And you were there on a day that they were doing Mohs surgery.
Exactly.
So that's great to talk about that, because actually coming up in May, it's Skin Cancer Awareness Month.
Yes, it is.
So what should our viewers do, not only just in May, but throughout their lifetime, to take care of their skin and make sure they're checking out little spots?
Exactly. So skin cancer is truly a cancer that you, the patient, or the patient have the power to help diagnose. Okay. I would say that almost all skin cancers that come to us in dermatology are brought to our attention because the patient notices them. Mm-hmm. And I think that it's important, if you have a spot on your skin that is changing, that is evolving, that is bothersome, that's itchy, that's bleeding, you should bring it up to the attention of your dermatologist, because we have the ability to look at these things. If they're concerning, we can do a biopsy and we can find skin cancer. And I think the earlier you catch it, the better it is for your health. Okay. And that's part of what we're here for as dermatologists.
Right. Well, that's great information. How young should people start checking out their skin? Like, should moms be looking at their children for certain little things?
Yes, absolutely. So there's no general consensus for at this age, you should start going to the dermatologist for skin checks. What I will tell you though, is that I have seen skin cancer in kids as young as 7 years old, and there's literature out there of kids in infancy as toddlers having melanoma. Wow. So it's not just a disease process that you see in adults, but in general, there are some recommendations where, if starting at the age of 35, if you have a family history of skin cancer, family history of melanoma, if you have a personal history of more than 40 moles, if you have one or more, two or more atypical moles, things that look a little funny. Now what I mean by that I think about the A, B, C, D, E's of moles. That's your asymmetry, border irregularity, so it looks a little irregular. If you have color variation, a couple more colors, if it's bigger than a pencil eraser, that's your diameter, and if it's evolving, those are reasons why you should get checked out.
Okay. So once someone, let's say they did come to you and you noticed that it was a skin cancer and they got it removed or taken care of, is that something they should continue to come back and have checked?
Absolutely. Okay. Absolutely. You should get your birthday suit checked on your birthday once a year. So that's a great idea.
Oh, that's perfect time. That's perfect. Well, I wanted to also talk about some things that were up and coming.
Yeah.
So at Advanced Dermatology, what I like to do is I like to go around to the different locations, introduce myself, and see what they're doing at those locations. Is that something that you've ever done or something that you're interested in doing?
Yeah, yeah, I think it's great. I think that Advanced Dermatology has a lot of wonderful physicians, a lot of wonderful providers, and I think that the community needs to know them. I think this is a great venue for that.
Yeah, I agree with that. All of the locations that I've gone to, everybody's been so knowledgeable, so personable, and really open with what they're doing there, and kind of greet you with open arms.
Absolutely.
So
check it out.
Check it out, Advanced Dermatology. And not only are they just dermatology providers, but they also offer cosmetic and aesthetic services too.
Absolutely.
So, well, thank you for joining me today.
My
and
pleasure.
One last thing I wanted to say was, everybody out there, if you've got something going on with your skin, don't conceal it. Let's fix it.
Boom!
Boom. We're back and
we're back.
we're back, and we are going to do a Did You Know section.
Did you know?
Did you know? Tell us.
What did you know?
What do?
So, here's something that I really want people to know. There have been studies, did you know that there have been studies that have shown that people that use daily sunscreen, so they use it every day, they put it next to their toothbrush and their toothpaste, they brush their teeth, they put on their sunscreen. People that put on daily sunscreen compared to people that do discretionary sunscreen, which is, I'm going outside, I'm going to put my sunscreen on, which is probably what most people do. People that put on daily sunscreen, they have 40% lower risk of skin cancer. They age 24% less fast, or 24% slower. So daily sunscreen is one of those things that getting into a rhythm of that can significantly help your skin. And that's something I want you to know.
Very nice. Did you know? Did you know that patients tell me all the time that they wear sunscreen and wide-brimmed hats and that it doesn't work? And I tell them, well, did you know that like an umbrella, when it's raining outside, you have to have that shielding you. You can't hold an umbrella over here and protect it. So if you're wearing a wide-brimmed hat, did you know that when the sun's above you, it works? When the sun is to the east or west of you, you have to tilt your head in order to get that shading. Otherwise, you're going to get the spots and potentially cancers on the side of your face. And baseball caps, they're not good enough.
Nope, absolutely not. That's great. Did you know that shade-seeking behaviors are some of the most powerful things, is one of those powerful things you can do for your skin?
Yes.
So it's okay to be out in the sun, but seeking shade is by far one of the most important things that you can do out there.
It's true.
There's sun-smart behaviors. There's sun-safe behaviors. The sun is not your friend between the hours of 10 a.m. and 4 p.m. There's so many things that people should know.
Definitely. When I'm going to a little festival or something, guess where I'm walking? In the shade. I'm not on the sunny side of the street.
Boom.
I'm in the shade.
Boom.
Somebody stops to talk to me, I put them in the shade. Let's go under this tree. Number one, it's 10 degrees cooler. Number two, you don't have to worry about aging so quickly, as you mentioned.
Exactly right. And that's why her skin looks so good.
Oh, thank you. Advanced Dermatology.
There it is. Out.
Bye. We got an action.
Action.
Hi there, my name's Noel with Advanced Dermatology. I'm here with Dr. Charlie Lucky Dunn. Today we're flipping the script on him. Normally he's asking the questions, but today is my job to do that. Thank you for joining us today.
My pleasure.
So today, or restart it.
It's okay, honest.
Go. Oh, fart.
That makes you look great. I feel like I'm gonna bring down the beauty of this segment. I feel like you're gonna have to like fuzz me out.
OMG, you're so silly. Okay.
Perfect.
And then what else is your job?
Everyone thinks more.
Every what?